What you are seeing is a patient who has got a foot drop at his right side. As you see, the left side foot is dorsiflexing well, whereas the right side is unable to do the dorsiflexion. Oftentimes he is losing balance as well. So this foot drop is the result of the nerve compression in the disc level. Surprisingly, this patient is not mechanically having a massive disc herniation or a major cardiac lesion as per the MRI, but clinically he is having a foot drop and sciatica. So this patient is a chronic back pain patient, and for the past 20 days or so he developed foot drop. This is an example of how a foot drop can develop chemically because of the inflammation around the nerves due to the slight disc bulge. Whereas this is not a surgical standard for the patient to undergo a surgery. That's why his neurologist dismissed him, stating that he does not need surgery because there is nothing in the MRI to operate, wherein the nerve is actually getting compressed, not mechanically but chemically. This is an example of how a chemical or inflammatory reaction around the nerve, even with the slightest of the disc bulge, can cause nerve compression and subsequent muscle weakness. This is also one of the reasons why people who actually got a real foot drop due to the massive disc herniation, when the surgery is done, immediately they won't improve because mechanically they may have got operated, but chemically the inflammation still persists. When you talk about sciatica and disc herniation, part of the pain is mechanical, part of the pain is chemical. So mechanical we can give exercises, but chemical you need to wait for time, and sometimes anti-inflammatory drugs and to some extent steroids also could work.